So let me start the recording. Okay, we are recording now. Anyway, so my name is Christina Dobler, and I'm coming to you from Reno, Nevada. A little bit about myself. I have two young adult children. They are, the lifeline to my world for sure. And they are one of the many reasons why I try to stay fit and healthy so that I can continue to prosper and live long with them. And I come from a background of fitness and nutrition. I have been in the exercise fitness instruction world for, probably 20 years plus now. And my journey began really because I was a gym rat and an exercise fiend. And I just kind of decided I was going to become an instructor so I could kind of get free gym memberships. And then I found a love for empowering others, for education about helping people become fitter and have fun with it and the whole 9 yards. So that my journey began, and I got involved with being an instructor through yoga training, which my dear friend Karen is an amazing yoga instructor. And then I became instructed in Pilates. I loved Pilates. I was one of those candidates that was taking Pilates classes, and I wanted to do more of it. So I got certified in Pilates. Now, a little bit of background with my childbirth, because I kind of think this is how this is all going to weave in. I had a pretty traumatic first childbirth with my daughter. We attempted a home birth, and it was long labor, a lot of pushing, and I feel like that could have been the very beginning of some of my female problems. Now, this was 22 years ago. But what I was finding was when I was teaching fitness classes, I was hearing women all over the board saying, oh, I have to wear panty liners when I do cardio, or I can't jump on a trampoline, or, when I do jumping jacks, I pee my pants. And even in a lot of my Pilates classes, I love it, Karen. A lot of my Pilates classes, I would hear this as well. And when we teach and learn Pilates, we understand that the pelvic floor is the floor of the abdominal, and it's the floor of the core. And so I learned a lot about the pelvic floor, and myself would have a little bit of urinary incontinence. Maybe sometimes when I was running, sometimes when I was jumping or laughing or sneezing. And some of you are shaking your heads and you're like, yeah, me too, me too. So I thought, okay, something's not right here. I'm fairly fit, fairly young. And why is this happening to these women and myself? So I sort of sought out a search engine, because I was doing Kegel exercises, but they were not working. And quite honestly, I did them around my pregnancy, right after my pregnancy, but I didn't really follow through with it. And I thought just by working out, that was good enough. So I heard about a program called Pfilates. Pfilates stands for pelvic floor Pilates. And it was being put on by a local OBGYN, a urogynecologist in Reno, Nevada. His name is Dr. Bruce Crawford. He actually still does this today, and he actually has a separate business designed for this. So he was doing a workshop. I attended the workshop for myself. And at the time, I knew that this was something that I could use as a vehicle to help other women. Being in the fitness world, I could bring this into my classes. I could bring this and give this knowledge out to others. So it worked for me. Within a matter of a month of consistently doing these exercises, knock on wood, I no longer have any incontinence issues. So I am good to go. Every so often, if I have a urinary tract infection or something like that, I kind of have some leaking, but I go back to my Pilates exercises for probably a week or so, and my body remembers it, and I kind of get back on track. Then from that point on, I became certified through Dr. Crawford to certify others. So I actually worked with him for a couple years in his office. I was traveling with him. We were doing webinars throughout the United States. And I was actually training other medical people, doctors, nurses, physical therapists, fitness instructors in the Pilates theory. So that was a lot of fun. inside Dr. Crawford's office. I actually worked with him in a laboratory setting. I'll explain that a little bit further, but it's called a Vesi lab, where we were kind of diagnostically testing females' anatomy and muscle weakness and improvement. So it was a lot of fun. I had a lot of experience and a lot of background, and saw, like I said, I've seen it all. So I've got the pleasure to work with, gosh, girls as young as 16, ballerina dancers, things like that, all the way up to women that are in their 80s and 90s, and everything in between. I've worked with hardcore athletes to very deconditioned, overweight, and anything in between. So this is something for everybody. Now, the reason that I wanted to continue on with this is because I kind of let it slip back. You know, I was doing this for many years, and then I kind of got involved in, I have my own personal health and wellness business. So that kind of took over my life. This Pilates was sort of put on the background, and I was still doing it myself, but COVID hit, and I started thinking about how can I reach out to more people, and use some of the knowledge and some of the strengths that I just have in here to give back in other ways. And so one of my friends said, you know, I want to talk to you. I'm having some pelvic floor stuff, and I knew that you taught this program. And I'm like, you know what? I need to bring this back. I really do. I love doing this. I love helping people. And so this is kind of where we're at today. So fast forward, my goal is to probably do one of these workshops about every other month or so. And I love having a small group setting like this because I want to keep it sort of close and individualized, open for questions. But just know that I'm here. So if this is something that maybe in the future you hear of another friend or another person that might benefit from this program, refer them. No problem at all. So that's a little bit about me. My gosh, that's a big rant and rave. But that's where I come from. So I feel really confident in the pelvic floor Pilates theory. Like I said, after having two children myself and hearing about all these bladder control issues from my clients, I knew that this was an area of health and fitness that needed attention and needed some professionals that were honestly willing to spearhead the movement. I, without shadow of a doubt, believe that bladder control is a fitness issue. And my goal today is to really give you knowledge and background and instruction to increase your pelvic floor fitness through the Pilates method. Because things like urinary incontinence, stress incontinence, overactive bladder, basically this is a consequence of pelvic floor muscular weakness. That's why I believe it's a pelvic floor, or it's a fitness issue. And if you even think about it, it's really, our pelvic floor muscles are like any other muscle group. They can become deconditioned. Just like anything, if you don't use it, you're going to lose it. And you have to kind of be consistent, right? You can't just do these exercises today and then not go back to it for a month from now. You're not going to get the results. So it's just like the gym. You've got to go in a couple times a week and do something daily to start to see these results. And I will say that it is never too late to increase muscular strength and endurance. It's never too late. So if you're here today, and most of us are here today because we're experiencing some form of pelvic floor weakness, it's not too late, and this will benefit you. I also love to work with pregnant women because I love to work with them in a sort of preventative factor, because we all know that childbirth is kind of traumatic down there. Now, I'm not against working with physicians. Obviously, a physician is the one who certified me, and there is a place for surgery. There is a place for drugs and prescription medication to help with this. So I'm not against that. I just believe that this can go hand in hand. And oftentimes I'm like, let's try this first and then maybe seek alternatives. So know that I am not a doctor, and I'm not giving you a cure for anything. I'm just giving you another tool to put in your toolbox to use along your journey. Okay, now let's back up a little bit. Dr. Arnold Kegel, he was a gynecologist who really was a pioneer and a big advocate for women's health in the 1950s. Unfortunately, Kegels are there's very poor compliance with Kegels. I believe that Kegels, because they're an isometric exercise, there's poor compliance. And so I'll explain this a little bit. Isometric basically means that it's a static, constant contraction without really any range of movement of exercise. So it's kind of just like a hold type movement, if that makes any sense, versus a concentric exercise, meaning there is movement. People do better with compliance when there's movement in the exercise. It sounds really simple and very basic, but it's the truth. People are much more compliant when they're moving. So the basis of this is kind of a combination of Dr. Arnold Kegels and then Joseph Pilates. He was the gentleman who came up with the Pilates movements. Joseph Pilates was actually a nurse that was working in World War II, and he came up with Pilates methods to sort of use as rehab for wounded soldiers in the hospitals. And so what he was using was the hospital bed springs as sort of, if you've ever done Pilates, you know that there's sort of a pulley lever spring system for resistance. And that is the basic start of his Pilates movements, all core strengthening, because his theory is everything stems from the core. The core isn't just your belly, it's your pelvic floor, it's your inner thighs, it's your back muscles. There's a lot more involved than just your stomach. Then Joseph Pilates took from that theory, brought it over to the United States, New York City. He opened up his first studio. He was working with the New York City Ballet. Pilates for many years was only worked with dancers, and now it is full mainstream. It is in physical therapy, it's in gyms, it's right in there. So this is where the birth of Pilates comes from. It's the combination of Dr. Kegel's pelvic floor muscles, Joseph Pilates, we throw it together. The 10 movements that you guys are going to move to or learn today were chosen by testing over 120 different exercises. Now, some of these exercises did come from yoga. Some of them just came from basic personal training exercises, and some of them are Pilates movements. And we were studying these movements to figure out which movements were the ones that engaged the pelvic floor muscles the very most. So the top 10 were pulled out, and this is where we came out with the Pilates theory. The data on these studies was actually collected through an EMG machine. That stands for electromyogram recordings. Basically what they did is they put sensors on volunteers, and they measured the muscular contraction. So they were measuring when a woman would go down into a squat or when a woman would do a sit-up, and they were measuring what was going on. And so through that data, we pulled out the top 10 and kind of figure out which ones were going to be the most compliant, the most kind of broad spectrum, meaning that we could obviously share with a lot of other age groups, because we do work with people that have injuries and elders and so forth. So anyway, all of these exercises can be modified, which is very nice. So if you struggle and you're starting to see like, oh my goodness, I am not quite sure if this is a fit for me. Sorry, I've got hot tea spilling over there. I liked watching it. You know, if you're having back injuries, you have knee injuries, hip injuries, if something doesn't feel good for you, make sure you're communicating with me so that I can modify and work around what's going on with your body. Okay, so now a little bit more. We're going to talk about some different co-recruiter groups. I've got to fix this tea. I don't know what is going on. One thing I'm gonna plug real quick before we go into the kind of physiology and anatomy here is after this, if you feel like you want further education, further information, I actually offer a DVD kit. I know DVD, it's kind of disco, but some people still watch DVDs. this is an additional fee. This is totally optional. You do not need to do this, but I do know that some people like to have something in their library. A DVD kit is $40. What you're going to get is you're going to get a DVD that's basically going to show you all the exercises that we're going to do. You just plug it in. You can do it with the TV. You're going to get a little manual booklet that actually shows like the pictures of the exercises, a little bit of description on how to do the exercises. And then you're actually going to get a blow up little ball. We are going to use a ball today. If you don't have a ball, don't worry, don't freak out. You can use a pillow. It's totally fine. So you would get all three in that kit if you want to. If you don't want to, or maybe you're going to try it on your own and you come back to me in a year from now and go, you know what, I think I need that kit now. Optional. So I just wanted to plug that and just let you know that that's an availability for you. Okay, so back to, let's talk a little anatomy. Number one, when you think of the pelvic floor, I want you to think of the pelvic floor as like a little basket of muscles. The pelvic floor literally is woven together of all these little tiny muscle groups, and the basket holds all basically our important female organs. It's going to hold your bladder. It's holding your uterus. It's holding up your vagina. It's holding up your anal. It's holding up all of this. It's all in this floor. Now, if these muscles become a little weak and deconditioned, they're going to loosen up a little bit. They might even stretch with age and hormones and all these things. So then what happens is these organs are not in place. They're not in the same position that they should be. Sometimes in cases, prolapses can occur. Sometimes in cases, these muscles are not going to function the same way. And that way, that's going to affect the organs that are not going to then function the same way, if that makes sense a little bit. So let me talk a little bit about kind of the main things that I tend to see happening. I did go back and talk a little bit about childbirth because our goal today is not to figure out why this has happened to you. We don't know. We have no idea. But I do know that it does have a significant effect on many, many women, even if you've had C-sections. Yet even postpartum, what kind of frustrates me, postpartum, most women aren't even really given instruction on how to recover the pelvic floor. It can take up to 6 months after childbirth to recover fully. And I'm talking doing things other than just Kegels. Also, hormone changes happens in pregnancy. It's happening with me right now as I'm going through menopause. So there's a lot of hormonal changes that affect your muscles. Relaxin, progesterone, estrogen, testosterone, they all have significant effect on the body's collagen. That is the elasticity and the tightness of your skin. Sometimes these hormonal changes can lead to permanent changes if they're never fully addressed. And so that's one thing that we could talk about. Obviously, there's muscular, there's neurological things that happen during childbirth, especially during the pushing phase of childbirth. If you've had any sort of what's it called when they do the cutting? I can't think of it right now. But you know what I'm talking about. Episiotomy. Thank you. I was like, what is that called? That can also kind of hinder some recovery. If you've had hysterectomies, any sort of cutting and invasive things inside of you, this is all going to affect you guys. So I do want to also talk a little bit about nerve damage. I know sometimes nerve damage can happen through various things, even heavy lifting. I had a lady that was a CrossFit woman, and then I had another lady that was working on a farm, and we kind of evaluated that a lot of their injuries was from heavy lifting. The farm lady was lifting barrels of hay and things like that. So it's really, really interesting how this can all lead to actual nerve damage. And once a nerve is stretched beyond 15%, its function is affected. And there's been a lot of studies that heavy lifting, stress, injuries, maybe you've had some sort of fall, a back injury, all of these things can lead to nerve damage. Some of the common pelvic floor disorders that I work with, and this may be you in the category, um, incontinence is very, very common. There's a couple forms of incontinence. There's the stress incontinence, which is basically leaking that's associated with any sort of increase in abdominal pressure. So that would be like coughing, sneezing, jumping, laughing, anything like that. That's stress incontinence. The other type of incontinence is kind of what I would call overactive bladder, or overactive bladder. Yes. So overactive bladder is something where you sort of feel this heightened sensation, heightened bladder sensation, and your bladder is basically contracting at the wrong time. So it's a sensation that you have to pee all the time, or maybe you go and then you pee just like a little bit, and your bladder's not even really full. Those types of things. You're getting up frequently through the night, 2, 3, 4 times a night. That is not good. You should not. Honestly, maybe once a night could be considered normal. Anything beyond that, you have a little bit of an overactive bladder issue. So we could try talking to you a little bit more about that. Also, anal incontinence. That's really common. Believe it or not. I know this is not fun stuff to talk about, but we're just going to get real, you guys. Anal incontinence is basically, it could come from a tear right around your sphincter. It could come from nerve damage. It could just come from a lot of loss of senses and damage around that area. So a lot of times people can have constipation, diarrhea. Sometimes they're very gassy, and they can't even tell if their contents are gas, liquid, or solid. So it's not fun. And the thing that gives me a lot of passion is these are issues that we're ashamed to talk about. Even sexual dysfunction, you guys, this is something that happens obviously later on in our life, but women especially are complaining a lot about sexual dysfunctions, where it's not fun to have sex anymore, right? I read a study the other day that 42% of women are having sexual pain, or maybe their lubrication has decreased, and then that can lead to other circumstances. So painful intercourse. The tissues are getting thinner, muscles are getting thinner. This leads to other things. So this is stuff we don't want to talk about. We're embarrassed to, but we need to, because it can be fixed. So that's kind of why I'm coming to you, because this is stuff that's common. And the more people I talk to about it, the more I'm like, oh yeah, me too. Oh, good. Let's talk about it, So, anyway, so those are just kind of the main things that I work with, but I also do work with a little bit more extreme areas called prolapses. Basically, what a prolapse is when there's just a little bit of a drop of one of your organs outside of your vaginal wall. Maybe it hasn't quite dropped down outside, so you're showing it, but it has slipped. There's a bladder prolapse, there's a urethra prolapse, there's a rectum prolapse. Hernias happen quite a bit, hernias in the bowels. And so oftentimes if that's happening, you'll get a surgical option, the mesh implant. You guys have probably heard that. And surgery is great, but here's kind of a scary thought. Gosh, 25 to 40% of all prolapses reoccur within 5 years. And why do you think that is? That is because I don't believe that the medical doctors are actually treating they're just treating the symptoms, and they're not treating the cause. So they have to go back and have that surgery again and get it reappeared. So one of my passions is, if that's you, if you're headed that way or you've had surgery, I want to teach you these techniques so you do not have to go back in. Another scary thought is 40% of women between the ages of 45 and 85 will have a prolapse. Let me say that again. 40% of women between the age of 45 and 85 will have a prolapse. That's pretty high odds. And oftentimes it's more than one. So it could be a bladder and a rectum. It could be a urethra. It could be a bowel thing. So I'm not saying this to scare you at all, but I want you to know that this is real stuff. Real things are happening to women. And it's just, we'll talk all day about men and they got to take their little blue pill and blah, blah, blah. But they don't talk about women, and poor us. Just go get on your hormones and you'll be fine, and do a couple Kegels and you'll be fine. And that's not okay with me. And so that's one of the reasons why I'm so passionate about why I do this. Okay, a few more minutes of lecture and then we're going to go on. I don't want to get into any more of the nasty gritty stuff, but really I just wanted you to kind of understand the anatomy, the physiology, the background, and why we're doing what we're doing. Okay, the muscles that we're going to talk about. The pelvic floor muscles are really kind of designed of obviously the muscles that are right around your vagina. I want to talk real quick about a Kegel. If you are unfamiliar or it's been a while since you've done a Kegel, basically a Kegel exercise is the contraction of your vagina. You are trying to think about a scooping, lifting up inside your body versus a pushing or an exertion. It is not that by any means. I think oftentimes we're not even properly taught how to do a Kegel or perform a Kegel. And we do tend to find that over time, our muscles are so weak, we might not even feel it. We might be like, am I doing one? I don't know. I can't tell. And that's okay, because fortunately we have co-recruiter muscles that go along with the vaginal muscles that are going to help strengthen these vaginal muscles. Co-recruiter. That might be a new word for you. Basically, what co-recruitment means is when one muscle group contracts, it will automatically contract another muscle group. So here's a great example. If I was going to do a bicep curl, the main muscle group is my bicep, but the co-recruiters are my triceps, my forearms, and a little bit of shoulder. So these muscles are also helping recruit my bicep. This is important in the Pilates exercises, because if you can't get a strong Kegel, we're going to contract other muscle groups that are going to help contract the pelvic floor muscles, help contract the vaginal Kegel muscles, if that's making sense. Okay, now there are three main co-recruiter muscle groups that we're going to talk about. The first one is the transverse abdominis. That's basically our abdominals. It is the innermost flat muscles of our abdominals, and it kind of runs across our sides from the ribs to the front. These are the muscles that aids in compressing the ribs. Helps a lot in childbirth, in the delivery of childbirth. So that's one. We'll be talking about our abs quite a bit today. The second one is our glutes. We know what our glutes are. It's our butt. And the glutes are made of multiple muscle groups that aid in hip extension. So that's basically pushing your leg behind you. Leg adduction, bringing your legs together. And then also rotation of your hip. So the glutes are also another important co-recruiter muscle group. And I also believe that our glutes can become very, very weak because we tend to focus a lot on our quads and our hamstrings, doing a lot more of some sort of exercise or muscular group, and we let the glutes relax, and so they become weak and deconditioned. So here's the good news. The side effects of doing Pilates is you're going to get stronger abs and stronger glutes. Now the third muscle group is actually our adductors. These are your inner thigh muscles. There's several muscle groups involved in your adductors as well, but they basically perform the adduction of your thighs. So the bringing together of your thighs when you're closing your legs. So all three of these muscle groups are going to be facilitated and really, really important for this. All right, so we've talked about the four main muscle groups, pelvic floor muscle groups, which is basically our vagina. We know how to do a Kegel. It's squeezing, it's lifting up. I always say practice your Kegels when you're urinating. So try to stop your pee midstream and see if you can do that completely. That actually is a Kegel exercise. You are having to squeeze and hold. If that's difficult for you, practice that and do your Pilates and see over time, are you able to get to that? That's a great tester for me. Also, I try to think about like, man, if some of us still have our periods, if you have a tampon in and you're trying to lift the string of the tampon up inside your body, sort of that pulling up and in. Pro tip, when you are urinating, when you're peeing, just let your bladder empty normally, be patient, and let it flow. Do not force it. Do not push your pee. And I know that that's hard because sometimes we are in a hurry and we don't, maybe your quads are burning because you're hovering over the toilet seat or whatever, but don't force it. I'm telling you, it is not a good thing for your vaginal wall and your pelvic floor muscles. So try to relax, try to just let it happen on its own time, and literally go for the flow. Same thing actually honestly when you're sort of going and doing bowel movements as well. You really don't want to be pushing too hard. There's obviously a little initial, but if you're really exerting, that is also going to cause some further damage in your muscles, your nerves. It could lead to some anal issues and all sorts of problems. So again, if it's just a simple constipation issue, we can talk about food and some fiber and some other things that can work with this. But if it is actually an anatomy, physiological issue, that's a whole nother issue that you and I can talk about. I do want you to know that I work very closely with Dr. Crawford. He actually even knows that I'm doing this today. So I do converse with him. If there's ever something with you guys where you're like, I have a question and I don't know, I text him, I talk with him. Sometimes I've even referred my clients to go see him for further issues. So he's amazing and he loves that I'm able to bring this out there. Alrighty, now let's talk a little bit about the exercises. Each of the exercises has 3 stages to the exercises. And there's honestly a reason for all 3. And I want to make it very important because sometimes I do this too. Sometimes I like to take the easy road. Sometimes I try to go, well, let me just skip this part and I'll just get to that. Like, I don't like to do the warm up. I don't like to do the cool down. I'm just going to do the workout and then I'm going to leave because I'm in a hurry or whatever. Well, there's a purpose for a warm up and there's a purpose for the cool down. There's also a purpose for all 3 parts of each of our exercises today. So the first part of each exercise is called the repetitions. We know what that is. Repetitions demonstrates the movements. Repetition builds strength. So the more reps you can do, the stronger you are. When you're weight training, they'll say start off with 10 reps and then you're getting stronger. Maybe you can do 20 reps now. So that's what repetition is. The second part of each exercise is called hold. The hold phase is more of that isometric portion of the exercises. This contributes to building endurance. This engages slow twitch muscle fibers. We have fast twitch, we have slow twitch muscle fibers. Endurance is also very important. It's not all about muscular strength, but you've got to have muscular endurance as well, right? We want to be able to hold. Let's say we've got to go to the bathroom. We want to be able to hold it so we have enough time to walk across the room and get to the bathroom before it's too late. So your endurance muscles are very important for things like this. Okay, so we've got the rep, we've got the hold. Now the last thing is actually the pulses. The pulses are the phase that contribute towards muscular coordination, but it engages the fast twitch muscles. This is actually the phase of the exercises where the Kegels are going to be added in. So we've got the reps, the hold, the pulses. The pulses are going to become fast, but I will tell you, when we are learning today, everything is going to be slow. It's going to be over slow, very dramatically slow, because I just want to really emphasize the movements so that you understand how to perform them. And then on your own, as you get stronger, as you build your endurance, and as you can do these movements quicker, all three of these phases you're going to improve on. I'm not going to be able to write you a prescription and go, everybody do 10 repetitions for a 10-second hold with 10 pulses, because every single one of you is in a different phase of fitness, of life. You all have different things going on down there. So that's where you will sort of design your own kind of workout in your own way. And I'm more than happy to kind of sit with you and go, okay, what do you think? Where should I start? All right. So what we're going to learn is 10 exercises that you probably already know these exercises, but the difference is these exercises are going to incorporate the Kegels with them. When we're studying the EMG in the laboratory setting, it's actually called VESI Lab, VESY, VESI Lab. What we found is if a woman performs an exercise, great. She's getting some like numbers on the screen there. Wonderful. Whole pelvic floor is engaging. Fine. If she performs that same exercise and then does a Kegel in addition to that exercise, her pelvic floor is engaging 40 to 60% higher than if she wasn't doing the Kegels at all. So it's much more efficient and effective when we're doing these exercises and doing the Kegel with it. That's why we're incorporating the Kegel in common things, squats, lunges, things that we already know, but now we're bringing in the Kegel because we know that this is going to bring in the pelvic floor more. The other thing is by doing these exercises that are working on these co-recruiter muscle groups, we squeeze and strengthen those. They go hand in hand. It's going to squeeze and it's going to strengthen our pelvic floor as well. So it's all sort of this miracle bonding, working together, all in one factor. So, all right, now you guys ready to move? I feel like, oh my gosh, I feel like a little professor in a workshop here. So I appreciate it. And, again, I can't reiterate enough how important your questions are necessary after you go through this. I know this is a lot of information. Anytime I take any sort of webinars and workshops, I'm jotting down notes vividly, and then I have to go back and I have to go and process it and regurgitate it and think about it, and one thing at a time. So you're not alone. If this is kind of like drinking out of a fire hydrant right now, you'll get it. You will get it. And practice really will help you once you start doing the exercises itself. Now, I want you to think about, here's how you're going to do this. You are not going to go shut the door and tell your family, hey, I'm going to be gone for 20 minutes because I'm going to go do my Pilates exercises. That's not usually how this works. I want you to think about things that you're already doing during your day, and I'm going to give you examples. Picking up things off the floor. You're performing a lunge or a squat when you're picking up something from your floor. So when you're doing daily activities, I'm going to have you be more intentional in mindset, focusing on Kegeling and performing these co-recruiter squeezing. Also, a lot of us exercise anyway. A lot of us are doing fitness classes, some sort of workout in some way. Some of these exercises you're already going to see in your yoga, in your fitness classes, but you're probably not doing the exercise the Pilates way. So you're going to incorporate these also in your normal exercise routine. Or the third choice is to give yourself 5 to 10 minutes a day. That's all you need to do some of these Pilates exercises. That's it. So yes, dismiss yourself 5 minutes a day. Good to go. A little bit every single day will go a long way. All 10 of these exercises are not going to be your favorite. I can tell you I have about 3 that I love. Those are my 3. Those are the ones that I want to do. The others I'm like, I don't really like them. So as we're doing these today, I want you to write on your notes, you're going to star the ones that you like, the ones that you feel, the ones that you're like, oh yeah, I like this one. I'm going to do this one. That's awesome. I want you to work in your strength zones, not where you feel weak. So if you're finding like, I just hate this exercise, I do not feel this one, don't look at that and tell yourself, I need to get better and keep practicing that one. No, I'd so much rather have you work on the one that you like and you feel the very most and the best, and go with that one. So my goal is, out of, let's say, 10 exercises, that all of us can probably find 3 or 4 that you guys love, customize, individualize for yourself, that you guys will use as your daily routine. Sometimes you're going to kind of feel like you want to mix it up a little bit, and you're like, okay, one day I'm going to do these 3 or 4 exercises, and the other day I'm going to do these 3 or 4 exercises, and then the next week I'm going to switch it up and do these other exercises. So it's going to, again, it's going to be really, really customized to you, and that's all good. All right, let's start moving our little bodies now. What you'll want to do is, if you do not have a ball, I know some of you have dogs. I think Vivian, I even saw you had a dog too. Some of you guys have little play balls for your dogs. If you do not have a little ball of some sort, just grab a pillow of some sort. It could be just like, you can see my little dog in the corner here. It could just be a little accent pillow, maybe for your couch. I oftentimes have, there you go, Mom, I like your ball. I have ladies that travel a lot, and they're like, what can I do? And I'm like, you know what, you can take this with you at the hotel and just use a hotel pillow. It's not the end of the world. The paw is going to be used for feedback. It's going to give us something to push and squeeze against, and it's going to help engage the pelvic floor. There's only 3 of the exercises that we actually use the ball for. Okay, so the first one is, we're going to be up and standing. So I'm going to kind of readjust my position, and then you guys are going to stand with me here. And the first one is actually lunging. I have a little sip of my tea that's been spilling. Okay, I have to take a deep breath. My gosh, that is a lot. I don't ever talk this much, honestly. It's just kind of all coming out at once, and clearly I love what I do. So all right, let's put that over there. Okay, so lunging. I'm gonna give you guys some very basic techniques. Oh, I wanna make sure you see my body. Okay, so lunging, one thing just for basics, you guys, is when you do a lunge, it doesn't have to be a large, long stride lunge by any means. It's something to keep your balance. When you're lunging, your feet should be hip width apart, your back heel is lifted, and then you are bending into both knees. So it's not like your back leg is straight and just your front knee. You're bending both knees, and you're kind of dropping down and up, if that makes sense. The second thing that you want to check is, just make sure for safety, knee is over your ankle. So you're not forward. This is going to put some damage and some hurt on your knee joint. So just kind of align yourself so that the knee is over your ankle. Basic housekeeping. I just got to cover all bases because I don't want anybody to get hurt from that. Okay, so the first thing that we're going to think about, our main co-recruiter in the lunge, let me come down here, is our butt. So we're going to think about squeezing our butt. I know as a fitness professional, when I do lunges and squats, all I'm thinking about is quads. So I want you to now think about squeezing your butt. That's the number 1 co-recruiter here. Actually, I'm going to grab my, okay, here we go. Okay, so the peak engagement of the pelvic floor in the lunge is at the lowest point of the lunge. So it's when we're at the bottom of the lunge. So we're going to do this super slow, and what I want you to do, we're only going to do 3 of these, is you're going to step out. So just step out with one leg, find that lunge, and as you're bending into your lunge at the bottom, I just want you to squeeze your butt cheeks. Both butt cheeks, just squeeze them, and then just step back and relax. Let's do it again. We're going to practice this. Step out, drop down into your lunge, squeeze your butt. Just squeeze your butt, and then just step back. There you go. Just want you to start warming up and just squeeze the butt, relax the butt, and step back. Okay. Now, I don't know about you. I can squeeze my butt, and I can feel my pelvic floor engaging. But I have also been practicing Pilates for many, many years. That is just a natural thing that's happening because my butt is engaging my pelvic floor. If you do not feel your pelvic floor, again, don't worry about it, because as your butt gets stronger, your pelvic floor is going to get stronger. Okay, so let's go back into our lunge. I want you to step out, and I want you to hold this, and I want you to squeeze your butt. So the reps are what we just did. We did 3 repetitions. Now we're in the hold phase of our lunge. This is where I want you to squeeze and hold your glutes. Tighten them up. We're going to start off with a 3-second hold, but as you get stronger, I want you to build this hold time into 5 to 10 seconds, where you're isometrically holding and squeezing your glutes. Now from here, as we go into our pulses, and if you're burning, that's okay, you can rest and come out of it. The pulses are going to be up and down movements like so. Now the pulses is when you are going to add in the Kegel movement. So as you drop down, you're going to squeeze the glute, Kegel, relax the glute. Squeeze, Kegel, relax. Squeeze, Kegel, relax. Again, we're going very slow, but I want you to feel this. Squeeze the glutes, relax the glutes. Squeeze the glutes, relax the glutes. Pull the pelvic floor up, relax. One more. Pull the pelvic floor up, relax. Okay, step back. Let's take a break. We're going to do the other leg so we can give us a break. Okay, so clean this up a little bit. Again, remember we're going very slow, but your focus is on the glutes. We're going to do 3 lunges, then you're going to hold. In the hold is where you're going to hold that strong contraction with your glutes. From there, we're going to add the pulses, where you're going to go down and up. At the bottom of your lunge, you're going to go down, squeeze the glutes, try to incorporate a Kegel. Lift up, relax the glutes. Grab and hold the Kegel as you go down, relax on the way up. We're going to go slow. We'll probably do about 5 to 10 pulses, and then we will relax. Okay, so let's try the other leg. Try that with me. So we'll do 3 repetitions. So let's step out, squeeze the glutes on the way down, relax and step back on the way out. Good. Step forward, squeeze the glutes on the way down, and relax and step back. Good, you guys. That looks good. I can see you. Step forward, squeeze. Now let's hold here. Tighten up your glutes. You might have a little bit of weakness in your glutes. This might be hard for you to even feel this. So just think about putting your butt in a little wedge. Cinch it up. Okay, a little crevice. Now we're holding. Now we're going to go up and down, engaging the pelvic floor. So as we go down, pull the pelvic floor up and in. Relax halfway, relax the glutes. Drop down, squeeze the glutes, pull the pelvic floor up, relax. I'm using my hands because it kind of helps as a visual here. Good. I like that, Mom. And if you're a little off of balance, just use a chair or a lunge so that you can kind of really focus on your muscle groups. So you're squeezing, relaxing, squeezing, relaxing, squeeze, relax. Okay, you guys, good job. Love it. I'm looking at you, making sure you're doing it right. Awesome. Okay, so real quick, anybody have any questions on that? How are you feeling? Questions, injuries, weird, awkward?
So when you're going down, it seems like it's one butt cheek squeaky. Is that typical?
One butt, one side, one glute? Yes, very common. Oh. And that is just because of the way your legs are staggered. So yes, you're going to feel one more stronger than the other. But I do want you to try to bring both together. Yeah, that's super common. So think about that, you guys. We're lunging a lot throughout the day. I honestly sometimes will bring this into housekeeping things. If I'm like vacuuming, I try to do lunges. If I'm talking on the phone, you know, I'm kind of incorporating pelvic floor things as I'm doing that. I'm just in my kitchen and I'm doing lunges up and down, engaging my pelvic floor. Remember back in the old day where they're like, if you're sitting at a red light, do your Kegels. If you're brushing your teeth, do your Kegels, you know? So start thinking about other ways that you can add this in. So obviously the lunges is a very basic, it's a leg strengthener, but again, if you're not strongly feeling that pelvic floor, it's going to come over time. I promise you that. Okay, so do we understand where this is coming from? So the reps is the stepping out, stepping in, stepping out, stepping in. I would say 3 to 5 is a good start, one on one leg. Then you're gonna go out to your hold position. And I would say 3 to 5 seconds is a great hold to begin with your endurance there. Then you're gonna add your pulses where you're going up and down, up and down. I would say try to get 5 to 10 in your pulses. And then go ahead and switch legs. Now I'm gonna give you an example because we're going super slow today. So we were doing our squeeze, relax, Kegel, relax, Kegel, relax. Eventually, here's what I want you to look for your future. You're gonna get to the point where you're gonna be like, squeeze, 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 Kegel, 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 Kegel. Now, that's fast. What I'm doing though, in between, is I'm able to contract my glutes and relax them. Squeeze, relax, squeeze, relax. I don't want you going that fast until you fully are able to contract and fully relax. You've got to be able to do both parts of that. Does that make sense? So if you're feeling like all you're doing is squeeze, 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 and you're never letting that pelvic floor relax, it's not going to benefit you. You've got to be able to let it fully release, then fully engage. That's going to take time. It's not going to happen overnight. Your goal is to get there, to do it faster, but it's not going to happen overnight. Okay, that's exercise number 1. Number 1 is the lunge. Number 2 is actually the squat, squat exercises. Again, the peak, what is it called? The peak engagement of the pelvic floor is at the bottom, the lowest point of your squat. I'm going to show you 2 different positions. You get to decide which one you like the best. The first one is a wide squat position. So wide squat, your feet are going to be about shoulder width apart, not hip width apart, but shoulder width apart. Toes are slightly turned out. And so our main co-recruiters are our glutes, but we're also, this position, you're going to bring in your abductors, your inner thighs. So both of these get to squeeze to help add with the pelvic floor. Okay, so as we go down, this is where I want you to squeeze your glutes on the way down. Relax your glutes on the way up. See, it's kind of opposite of what we normally would do, right? Squeeze on the way down, relax on the way up. Put your butt cheeks in a vise, bring them together, squeeze, 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 and relax on the way down. As a fitness instructor, and Annie, and I know that Karen, you can relate to this too, we oftentimes tell people to push and squeeze on the way up. If you've got a bar across your chest, you're squeezing and you're pushing on the way up. This is opposite. I want you to squeeze on the way down. Relax on the way up. Squeeze on the way down. Relax on the way up. Okay, now let's hold this down. Take it down and we're just gonna hold. I want you to think about, here's a visual. You've got a quarter on the floor, and I want you to think about picking up that quarter with your glutes and your vagina. I know that's really weird, but grab it, pick it up, and then you're gonna pull it up, and then you're gonna drop the quarter in a little bucket down there. So go down, squeeze, grab that quarter, pick it up, relax it, drop it. Does that help you? I'm all about visuals. All righty. Now, as we're holding here, we've got everything engaged. A little bit of our inner thighs. You've got your chest up. Knees are tracking over your toes. Now we're going to add in the Kegel exercises through the pulses. So again, as you go down is when you're Kegeling. Down, Kegel, pull the pelvic floor up, relax. Down, pull it up, relax. Grab your quarter, pick it up, drop the quarter. Scoop and pull the quarter, drop the quarter. Squeeze your glutes, relax the glutes. Squeeze the glutes, relax the glutes. Kegel, release it. Pull the pelvic floor up, relax it. Again, if you are not feeling the pelvic floor, good, you guys, keep going. I want to just look at technique. You guys just keep going. If you're not feeling your pelvic floor, that's okay, because you're still feeling your glutes, correct? And the glutes are recruiting. Okay, good job. Nice. Okay, so take a break, ladies. That is a wide squat stance. I want to now show you how to do a mid squat stance. You might like this one better. This one does not, if you have a prolapse, you're not going to like that wide position. That doesn't feel good to you. So a mid option is with your feet hip width apart, okay? So they're a little bit closer. Your legs are a little bit closer. You might be able to engage your inner thighs a little bit better. But it's the same thing. I'm going to take a side view. As you go down into your little squat, this is not a deep squat either. This is just a couple inches, ladies. Come down, squeeze your glutes on the way down, relax on the way up. Squeeze your glutes on the way down, relax on the way up. Squeeze on the way down, grab that quarter, drop the quarter on the way up. Squeeze, bring those both glutes together, tight, 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 and relax. This is about having tighter assets. Tight, 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 and relax. Now we're gonna bring it down. We're gonna hold it into our hold phase. So think about this for a moment. What are we holding? We are squeezing our glutes. We're lifting our pelvic floor slightly, maybe a little bit of engagement of our inner thighs. Without fully relaxing, let's start adding in the Kegels. Drop down Kegel, relax. Drop down, squeeze your glutes, relax your glutes. Squeeze the glutes, relax. Squeeze, release. I know this feels counterintuitive. I know that you want to do this opposite way. So you've really got to focus here. I'm already feeling a little burn in my glutes. This is a good thing to be doing for your body anyway. Awesome, you guys. Think about your pelvic floor, lifting it up like an elevator, dropping it. Pull it up inside your body. Relax it. Squeeze. Good. Your goal, you guys can take a break, is get quick. Squeeze. Squeeze. Kegel. Kegel. Relax. Kegel. Relax. Kegel. Relax. Squeeze. Release. Squeeze. Release. That's your fast twitch muscle fibers. That's where the Kegel gets in. All right, are you okay? Whew. I am gonna tell you, you might be a little sore. You might be a little sore down there, especially you guys are gonna do probably about 300 Kegels today. So it's all good. All right, how you doing, Annie? Got it? I know this kind of seems simple and basic, but when you really put your mindset to it, it's intense. I remember the first time going through this, I was breathing heavy. I was sweating. I'm like, what is going on here? Why is this so hard for me? But I never really could fully get my mind wrapped around my pelvic floor. I'm like, whoa, like that adds a whole nother element, right? A whole nother level of intention to these exercises now. We squat all the time. Some of us have doggies and we're bending over to pick up their poop. Right, Karen, along with our doggy walks, do a squat and Kegel, incorporate that, you know. Add these into your daily activities. Okay, that's it for our standing exercises. So number 1 was the lunges. Number 2 is our squats. Number 3 is called side lying bent knee lift. So such a great word, right? It's very, very basic. Side lying bent knee lift. The movement is designed, the peak engagement of the exercise is when the top leg is raised up halfway at a 45-degree angle. I'll explain it to you once we get to the movement. So I'm going to lie down on the floor a little bit. You guys are going to lie down with me. You're going to be on your side. Let me move my mat just a little bit here so you can see. Okay. This is kind of bringing back my age, kind of some 80s exercise movements here. All right, as you sideline, obviously you can use your head for support here. You can rest your head completely down. If you're having your pillow, you might even want to use your pillow for your head. But the legs at this point need to be at a 90-degree angle. So from your hip, your knees need to be straight out at that 90-degree angle. Same thing with your ankle and your knee, 90-90. So it's a nice right angle. We're going back to our geometry here. Okay, the peak pelvic floor engagement is when the leg is raised up at a 45-degree angle. That is not all the way up, that's 90. It's halfway down, about 45 degree. Remember, this is scientific clinical trials that we've realized that this is the movement where the Kegels come into place. This is why at those certain points in the exercises, this is when the Kegels are going to come in. Not up here. That's not when the pelvic floor is being engaged. It's the 45-degree angle. Okay, so two main co-recruiters are the glutes and the inner thighs. Obviously now the abs are coming into play. The abs are always engaged, but you're going to need your abs because otherwise you're going to roll back and forth here. As we lift our leg up to 45-degree angle, I want you to squeeze your glutes, a little bit of your inner thighs, and then you're going to lower the leg, close it, relax your glutes. So lift up 45 degrees. Notice that my feet are separated, right? They're not touching. They are separated, okay? And then you're going to relax. Let's just practice this a little bit. As you're squeezing your glutes, focus on the bottom butt cheek, okay? Not just the top one. The top one, that one's going to automatically squeeze, right? Because you have to lift the leg. Think about the bottom butt cheek and bring it towards the top butt cheek and relax. Good, you guys. That looks amazing. It's perfect. I know it's very basic. Maybe you can also now start thinking about your abdominals, pulling the abdominals up towards the crown of your head. Now let's hold at this 45-degree angle. I'm already feeling a little burn in my glutes here. Hold here. Your butt should be tight. This is where we're going to think about lifting our pelvic floor. Now it has to go towards the crown of our head. We're not working with gravity anymore. Up and down is where the pulses are going to occur. So as we lift slightly, you're going to squeeze and Kegel, lower halfway, relax. Squeeze and Kegel slightly and lower halfway. Squeeze and Kegel both butt cheeks and lower. I love this one. I can feel my pelvic floor on this one. So here's a cue. Think about if you were to pass gas and you want to hold it in. You know that feeling? That's what I want you to think about here. You're squeezing so tight that you do not want to pass gas. Squeeze, release. Squeeze, release. Kegel, relax. Pelvic floor, relax. Abdominals and glutes, they're all working. You guys pay attention. Tune in with your muscles. That's the way. Okay, I'm going to need to take a break. You probably do too. I can feel it in my butt. That's why I'm saying, like, side effects is a little bit of firming and tightening in your glutes. This is all good. Here's when you can do this. When you're watching your Netflix and you're binging, right? Or you're watching your Today Show in the morning. Lay down. Do a few of these exercises for 5 minutes. It's not going to hurt. Let's flip over. Let's do the same thing on the other side, just so that we can give this side of our body a little rest. If you want to, you don't have to. But I just want us to practice this so you master it. So remember, we set it up 90-90. We've got a 90-90 degree. And as we're lifting, we're squeezing both butt cheeks. So as we lift, 45 degrees only, squeeze both butt cheeks and lower down, we relax. 45 degrees, lift up, squeeze both butt cheeks, tighten your abdominals, and relax. Good. Lift, try to squeeze both butt cheeks, and then lower down. Now we're going to hold on this next one. So let's bring it up, let's hold. You are at a 45-degree angle, you're holding in gas. You do not want to pass gas. Tight. Everything is tight. Hold it anywhere from 3 to 5 seconds. Now we're going to add the Kegels. So as you lift your leg just slightly, Kegel, halfway down, relax. Squeeze the glutes, Kegel, halfway down, relax. Squeeze and Kegel, relax. Squeeze and Kegel. If you feel like you can go faster with control, do it, okay? Both butt cheeks. If you can't feel your pelvic floor, focus on just the glutes. And Kegel, and Kegel, and Kegel. Good job, you guys. That's fantastic. Yay! Awesome. Okay, wonderful. Okay, so that is exercise number 3. It's basically just called the side lying bent knee lift. If you are finding you're like, I really like that one, star it. Again, I want you to be aware of the ones that you like and the ones you don't like. Next exercise. Exercise number 4 is called side lying straight leg circles. I didn't make these up. Okay, side lying straight leg circles. The peak engagement is when, and I'll show you, is when our leg is in the forward sweep movement and the leg is lifted at about a 45-degree angle. I'll show you that. And I just say this only because I want you to understand why we're doing the Kegel at that particular range in the movement. Okay, so on this one, we are lying down again, side lying. Your legs are going to be straight this time. And you want to have your legs just slightly in front of you. So not at that 90-degree angle, also not straight out, but maybe just halfway in between. I want you to be able to see your toes. That's kind of a good cue. All right, now the circles, these are small circles. These are not large leg circles. When people do movements like this, there's no way you're going to be in control. There's no way you can tighten your abdominals. There's no way you're going to feel all of this. So I want you to think about maybe the size of a soccer ball is about the size of your circle. The peak engagement of your pelvic floor is in the forward sweep right here. This is actually where we will be holding and we'll be doing our Kegels. They're going to be little leg lifts. So what we're doing is drawing a small circle about the size of a soccer ball. It doesn't matter what direction. When our leg goes up to the top of the circle, this is where we're squeezing our glutes. Squeeze, 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 squeeze. As it goes down, we're relaxing. Now we're sweeping forward. We're about to engage. Squeeze the glutes. As it comes back and down and around, we're relaxing the glutes. Forward sweep. Squeeze the glutes right here. Bring it up to the peak. And as it goes down, we're relaxing. Forward sweep, squeeze the glutes. Relax, relax, relax on the way down. Now let's hold here. Forward sweep, hold. Your top leg should be in front of your bottom leg. Both butt cheeks should be tight. Inner thighs are tight. And now we're gonna add the Kegels. It's a lift up, squeeze, relax halfway down. Lift up, squeeze, relax halfway down. Both butt cheeks squeeze, relax. Add your Kegel, Kegel, release, Kegel, release, Kegel, release. Squeeze your glutes if you can't get that Kegel engaging. Just work on the glutes. Tighten the tummy. Good, let's do 2 more. And then we're gonna relax and let it go. Woo! How's that one feel? Again, a great exercise just to incorporate. Put your book down, read your book. Do a couple chapters while you're doing your exercises, right? So you're just gonna do 3 to 4 repetitions, then you're gonna go right into your hold, 3 to 5 seconds, and then your Kegel, release, Kegel, release, Kegel, release, Kegel, release. Let's roll over, let's do the other side. I want you guys to be balanced out. And remember, all 3 parts of our movements is important. I know we all want to skip that. We just want to get to the Kegel part, but remember the reps is for strength, the hold is for endurance, and the pulse is for the fast twitch Kegel part of the Pilates method. So don't skip any of the or parts of the phases, if that makes sense. Okay, straight legs, a little bit of about a 45-degree angle so that you can see your toes. Okay, we're gonna draw a soccer ball size, so you're gonna come forward, squeezing the glutes on the forward. As we peek up, this is where we start to relax. Relax, circle down. Squeeze the glutes, forward sweep here. Relax as you're coming down and around. We're gonna do 3 to 5 of these. Squeeze, 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 get the bottom cheek going. Relax on the way down, circle, come forward. Squeeze, squeeze, squeeze. On the next forward sweep is where we're gonna hold it. So bring it forward and hold. Tighten both butt cheeks. It's like you're holding in gas again. Okay, make sure you can see your toes. And then we're gonna lift up and down, squeezing and Kegeling. Lift halfway, Kegel. Relax. Lift halfway, Kegel. Relax. Squeeze. Release. Squeeze. Release. Squeeze. Release. Nice. Pull the pelvic floor in. Tighten the glutes. Tighten your belly. You got it. Good, girls. We'll do 2 more here. Nice job. And relax, release. Woo, okay, well done. Exercise number 4 is done. Straight leg circles. Any questions on any of those exercises that we've done so far? Speak up or forever hold your peace. Okay, moving on. Love it. Moving to a couple of my next favorite ones. Butterfly. This is number 5. Butterfly, the peak engagement for the butterfly is when the knees are brought together, just so that you know. So number 5 is the butterfly, and this is when the knees are brought together, peak engagement. That's when you're gonna see the Kegels. This is when you're gonna need your ball or your pillow. So grab that. I'm gonna have you guys stay seated for a moment, and I want you to just watch me. You're gonna lie down, but I want you to watch me do the movement first. So, and I'm actually gonna take sort of an angle so that you can see my legs. I want to get the lighting right here. Okay, so the first thing I'm gonna do is I'm gonna lift my legs up. Obviously my abs now are engaged. The second you lift your legs off the floor, abs are engaged. Also, you're gonna connect your feet now on this one. The feet are not gonna be separated. You wanna clasp and put those feet together. This is also kind of been called a clam position. So you kind of look out, you've got this position here. Keep your ball and your pillow close, but not yet. When the knees come together, you're gonna squeeze your glutes, your inner thighs, and your abs. Squeezing together, peak pelvic floor, relax. Feet stay glued together. They never disconnect. Squeeze, bring it together, relax, open. Squeeze, bring it together, relax, open. Now we bring the hold in. You're gonna grab the ball or the pillow. You're gonna hold, and you're gonna squeeze the heck out of the ball and the pillow. This is adding a whole nother level of engagement here. As we hold, this is where the pelvic floor starts coming in, and we're gonna add the Kegels. Squeeze, release, squeeze, release. I'm actually squeezing in on the ball. Together, I'm not lifting up, I'm not doing this, I'm not doing a crunch. I'm squeezing in and out, in and out, in and out. At the same time, really engaging my glutes. Okay, now it's your turn. So now I'm gonna have you lie down, and I'll do it with you. Bring the soles of your feet together. Your legs are up at a 90-degree angle, so knees directly over the hips. All right, girls, good job. So let's just practice a few repetitions. Bring your knees together, squeeze your glutes. Close the butterfly wings, open, relax your glutes. Bring your knees together, squeeze your glutes, and then relax and open. Okay, one more time. Bring it together, tighten your belly button. Bring your belly button deeper, deeper towards your spine, and then relax and open. Hold, grab your ball, grab your pillow. Place it in between your knees right here. Here comes the isometric hold. Now I want you to just grip on that. Hold that ball super tight, or that pillow very tight. With this hold, where can you bring more muscle activation in? Can you bring more glutes? Can you tighten your tummy more? There's a lot going on here. Great isometric. Now let's add the Kegels, you guys. Super slow. Kegel in, squeeze the ball or pillow, relax halfway. You never fully release. Squeeze the ball and the pillow, relax. Squeeze in on the ball and the pillow with your knees, relax. Pull the pelvic floor in and release. Squeeze, you guys, use that ball and that pillow for feedback. That is your workout partner right now. Keep that going. Good job. Let's do a couple more, and then we're gonna take a break. Awesome. Okay, quick little break. Relax, put your feet down on the floor. If you have back issues and this is not feeling good for you, you can do this option with your feet on the floor, and you can do the same movement. If you guys can see here, you can do the same movement. It's definitely not as effective because you don't have the abs going, but you still can do this movement here with your feet connected on the floor. That's okay too. Just know that that's an option. Okay, I want to do this one more time with you. I love this one. I think it's a good one. It's great for the abs. So let's try it again. Lifting those legs up, soles of the feet together, keeping our ball or our pillow handy. And when you're ready, we're going to bring the knees together, squeeze the glutes, and relax the glutes. Squeeze the glutes, and relax the glutes. Squeeze the glutes, and relax. Now we're going to hold on this next one. Bring your ball, bring your pillow, place it right in between your knees, and now clamp on and hold for dear life. As you're holding, draw the belly button in, push it down towards the earth. Squeeze your glutes, inner thighs together as tight as you can. Now add a Kegel, squeeze in, relax. Kegel, squeeze in, relax. Kegel, squeeze in, relax. Kegel, squeeze. Now let's try speeding this up. Try to go a little faster. Kegel, Kegel, squeeze, squeeze, squeeze. Try to give me 3 more. And 2, and 1, and relax. Okay, good job on that one. That one looks like the best one so far with all of you guys. That was fantastic. Okay, that was the butterfly. Very good work there. I love it. One thing I am not talking about at all today is breathing. Because obviously us in yogi world, we talk a lot about the breath and the body and all, but you guys, this is a lot of information. So as you begin to master the movements, then I want you to worry about your breath. As long as you're not holding your breath, I don't want anybody passing out. Just try to just breathe normal. You're going to naturally find that you're going to be exhaling during exertion. You're going to be inhaling on the recovery, but don't overthink the breath part of it, because that is, again, that's going to come later. Right now, I just want you to be really intentional on focusing on your muscle groups. Okay, exercise number 6 is bridging. Stay there, watch me do the demo first. This is a classic yoga, classic Pilates movement. You get to actually start with the ball or the pillow in between your knees already. Feet are on the floor, probably about hip width apart. If you have back issues, you are not going to lift up into a full bridge. You might just want to lift your hips up halfway. What we're doing, a peak pelvic floor engagement, is at the peak of the bridge. So you're going to squeeze your glutes and you're going to lift your hips off the floor. At the same time, I'm actually squeezing in on the ball. I've got everything engaging. You're going to roll down and relax. I'm actually going all the way down, tapping the floor. Squeezing on the way up, relaxing on the way down. I'm going to take it to my hold right here. My hold is sort of a reset button. I'm going to bring those knees together, really clamp in, trying to make a dent on that ball. And now what's really going to happen is we're going to do up and down pulses to engage the pelvic floor. So you're dropping down halfway, squeeze on the way up, Kegel. Halfway, Kegel. Halfway, Kegel. At the same time, I'm squeezing with my knees too. So there's a lot going on. This is going to be a test of your choreography, or coordination, not choreography, coordination. Okay, so they're just little tiny movements up and down, squeezing in on the ball. All right, let's have you guys try it now. So let's lie down. This is your bridge. This is what this exercise is called, the bridge. And put your ball or your pillow right between your knees. That looks great. Okay, we'll just do 3 of these. This is a pretty simple exercise. Squeeze your glutes, lift your hips off the floor, either to a full bridge or a half bridge, up to you. And then relax as you lower back down. Good, tuck your tail, lift your glutes off the floor, squeeze, squeeze, squeeze. And then as you lower down, you're relaxing. Nice job. As you lift up, we're gonna hold here. Peak pelvic floor engagement is at the highest point of the bridge, which is exactly where you're all at. Hold the ball, squeeze a little more with your knees. I know you can do this with that pillow. Now, your pulses are up and down, keeping the range in motion small. Raise and lower the hips up and down. As you squeeze up, peak engagement, pelvic floor. Relax, squeeze, relax, squeeze. Up and down. You're also engaging those knees, engaging the glute muscles in and out. That looks amazing. Good job. Yep, I love it. I love it. I love it. Nice work. Okay, take a little breather and a break. Come on down. Yeah. Okay, awesome. Looking good. All right, well done. Okay, I'm gonna have you guys practice one more time. I'm gonna do this one with you. I love the bridge exercises. It's a great glute strengthener. Let's do this one more time. Place the pillow or the ball right in between you. Make sure that we do this twice so that you get it. Take your hips up off the floor, squeeze the glutes, squeeze onto that pillow. And then relax all the way down. Good. Tuck your tail, round your spine, press up towards the ceiling, squeeze those knees together, and then relax all the way back down. Take it one more time, full height. If you can take it there, hold and squeeze. Peak pelvic floor engagement is happening right now. Now we're going to add in the pulses and the Kegels. Up and down, just lifting and lowering halfway, but make sure you don't forget to squeeze in with those knees at the same time. Up and down, your Kegel squeeze, good. Nice. You guys are actually able to go a little faster on your pulses on this one, which is great. That shows that you're getting good coordination. I think your body is starting to recognize and getting it now. Yeah. Okay, a couple more and then just go ahead and come down and take a little relax and break. Fantastic, good. Okay, any questions on the bridge? Yeah,
Feel it.
Yeah, good. I know it's good. I mean, I kind of told you it wasn't going to be a workout today, but granted, we're doing a lot today. So, okay, we're on number 7, corkscrew. I'm not going to lie, this is not my particular favorite one, just for my particular body, but I know that it does work for other women. So again, this is up to you. It's called corkscrew. So think of a wine corkscrewer. I'm going to demo it first, then you guys can watch after you kind of see me demo it. The peak pelvic floor engagement is when the hips and the knees are flexed in towards your body. So watch, I'll explain as we go. Okay, this is my old fitness, physical therapy mind getting to work here. Your knees are going to be back up to 90 degrees, but I'm going to crisscross the ankles. So if you guys can see that, I crisscross my ankles, take the ball or the pillow in between your knees. I'm going to cramp up on that. Now we're going to still think of a soccer ball size circle, but now it's going to be on the ceiling, and you're actually just going to do little circles with your knees. Now, the physical therapist in me thinks that, oh, as the ball and the circle moves away from me, well, heck, this is when all my stomach is engaged. So this has got to be when the pelvic floor is working. Nope, it's actually when your knees are closer to the body. So this is where we will be doing our hold and our Kegeling. The Kegeling is just going to be squeezing in and out with the ball. Okay, so we're going to do 3 circles. It doesn't matter what direction. It's the same thing with the leg circles. So as the ball moves away from me, my glutes are actually relaxed. As the ball comes towards me, I'm squeezing my glutes right here. As the ball moves away, I'm relaxing. Now this ball's coming towards me. Squeeze, 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 Kegel. Relax, circle away. Here it comes again. Squeezing in on the ball, squeezing my glutes. I hold. As I add my Kegels, I'm squeezing, relax, squeeze, relax. You guys can probably see there's a little bit of movement right through my hips and my pelvic area. I'm not lifting, but I'm just simply squeezing in, and that is going to cause a very natural pelvic tilt. So this is where the Kegels are happening. Squeezing, relaxing. So I like to do this one way, then I switch my feet, and then I kind of do the circles the opposite way. And then I hold, squeeze, 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 squeeze. Okay, your turn. Let's try ya. Let's lie down, crisscross those ankles, and lift your legs up to a 90-degree position. Yeah, good. Make sure you have your ball and your pillow in between your knees. You guys, yeah, okay, you guys got it. Okay, so you decide you're gonna draw a circle and just practice this for a little bit. It's a small circle. Knees are facing the ceiling. When you move your legs closer towards your chest is when you wanna focus on squeezing your glutes. As the knees move away from you, this is when you're relaxing your glutes. Go slow for the first few so that you can really feel that engagement. Keeping your spine down. You don't want to lift your tailbone up. Yeah, that's the way. Okay, let's all practice the hold now. So let's bring the ball or the pillow close to your knees or closer towards your chest now. That's the way. I need you to now squeeze a little bit tighter, a little bit more. Good. And now engage with the glutes and the Kegels. So you're squeezing in and out, in and out, in and out. Does that make sense? So you're literally just pulsing as you're squeezing the ball and the glute muscles. Add the Kegel. You're releasing the tension on the ball as you're relaxing your glutes and the pelvic floor. Squeeze in and Kegel, relax. Squeeze in and Kegel and relax. Good job. You guys, amazing. Love it. All right, let's take a little break and just relax. Yes. Oh my gosh. Okay, good job. Any questions on that exercise? I kind of feel like that is a really good one that really would maybe sync well with the bridging. If you're already lying down on the floor, you could kind of alternate and maybe do a bridge, and then in between, lift your legs up and do some corkscrews. Put your feet back down, do a bridge exercise. Pull, squeeze, lift your legs up, corkscrew. So those two, I feel like could really be a good sort of blend and a nice, easy sequence that would roll into each other. Okay, we're getting closer. We are getting closer. We have 3 exercises left. This next one is called hover. Hover. This exercise was actually rated #1 out of all of the pelvic floor exercises. So you're gonna wanna do this one. All the study shows, for whatever reason, this one is the one. Now the peak pelvic floor contraction actually happens when we're doing like a pelvic tilt. So again, I'm gonna demo it and then you guys will follow. We don't need our balls, we don't need our pillows anymore. Okay, you're gonna be kneeling. If you've got bad knees, maybe you do want your pillow again. I usually say get extra padding, maybe you need to be on a towel, maybe you need to be on carpet, something like that. Okay, first things first, I'll show you 2 different angles. This is Baja. See, I got doggies involved here too. You're gonna have your knees hip shoulder width apart and your feet need to be touching behind you. So there's a back view. My feet are not separated, my feet need to touch. Believe it or not, it makes a difference because we studied it both ways. This, for whatever reason, engaged the pelvic floor more. Okay, side view. What we're gonna be doing is we're gonna lower down halfway, not all the way down. I can't even get all the way down. So you're just gonna lower halfway down. This is total relaxation. Nothing's happening in my glutes. As I come up, I'm gonna take a little bit of a pelvic tilt and I'm gonna squeeze my glutes up to the peak. I'm gonna lower halfway down, relax, tuck my tail, squeeze my glutes and lift up. Lower halfway down, tuck my tail, squeeze up. So it's just kind of looking like this. Here's the front view, lower and lift. Squeezing on the way up. The peak pelvic floor engagement is at the top with a little bit of a pelvic tilt. This is where we're holding. So I have got my glutes tight. Now here comes the Kegels. It's kind of like a pelvic thrust. I don't know if you guys can see this, but I'm tucking under and poking my tail out. Thrust, under, squeeze, release. Kegel, release. Glutes are squeezing, lifting the pelvic floor. Here's the last trick. Watch my knees. If I can show this, I hope you guys can see it. Can you see how my knees are coming in together as I'm doing that? So I'm actually using my inner thighs. It's almost like I'm pulling the floor and zipping it up together. So there's a lot going on there. Okay, let's have you try it now. Come to your knees. There you go. Make sure your feet touch. It's like that butterfly. I like to just say hands on your hips. Okay, we're gonna lower down just halfway. Just as nice and easy. Now, as we kind of come back up, I want you to start bringing your tail underneath, tuck and squeeze. Try to pull those knees in. Relax halfway down, tuck the tail, squeeze the glutes, pull the knees together, and then relax the glutes halfway down. You're going to use a little bit of the resistance of the floor or your mat to pull those knees together. Tuck your tail and relax. Good. And again, tuck your tail, lift, 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 squeeze, hold here, hold. Everything should be tight. Your soles of your feet should be touching. Your glute should be tight and contracted. Now from here, we're gonna add in the pelvic tilt. So you're gonna tuck the tail under, squeeze Kegel, relax. Squeeze Kegel, relax. Thrust, release. Come on, you gotta show me you're sexy right now. Move your hips. Do not be afraid of moving your hips. It is truly a movement right here, back and forth. It is no longer an up and down. That's the way, ladies. Good. Tuck and squeeze. Squeeze. Pull the pelvic floor in. Yep. I love it. Good. Awesome, you guys. Nice work. Okay, does anybody have any questions on that one in particular? This is a really good one that I like to do when I'm brushing my teeth because you can do this standing as well. You can just stand with your feet slightly apart, and you can just do those pelvic tilts and Kegel at the same time that you're kind of tucking your pelvic girdle underneath itself. Okay, so that's called the hover. Top and peak engagement is when the tail is tucked underneath it. So you're doing those curls at the top of the movement, curling the pelvis, squeezing the glutes, engaging those inner thighs as well. There's a lot going on there. This one I get good feedback on. So try to master it if you can. A little bit of practice can go a long, long way. Star this one if you like it. All right, moving on up. We are now on number 9. This one is one of these famous old Jane Fonda movements. All fours, bent knee lifts, or I like to call it the fire hydrant. This will bring her back, baby. I'm showing my age. Okay. So you're gonna be on all fours. I love it. I'll demo this for you just a little bit. So again, just kind of some general housekeeping for safety. You wanna have wrists over shoulders, knees underneath your hips. Now, the peak pelvic floor engagement is at a 45-degree lift off the floor. It's not 90, it's not way up there, that's way out of control. This is a little movement, ladies. Right here is where you're going to be squeezing your glutes. Relax halfway down. Squeeze just 45 degrees, sorry, and relax on the way down. You're also engaging your stomach because you got to stabilize. You're also using your inner thighs, so all the co-recruiters are working here. Then when you come to your hold, you're going to hold it right here. Everything is nice and tight, and then you're going to add your Kegels with little pulse up, halfway down. Pulse up, halfway down. Pulse up, halfway down. Pulse up, halfway down. So you're squeezing your glutes. Here's your visual. I talked to you about that quarter earlier. Here's your visual. Someone's coming from behind you, and they're going to smack you super hard on your butt. What are you going to do? You're going to brace, right? If you know somebody's about to smack you, that's what you're going to do. So I want you to think about that. When you're squeezing the glutes, think about bracing that hard. Okay, let's try it, girls. Let's get on our hands and knees here. Okay. And we'll do both legs so that we are all balanced out today. So just lifting 45 degrees, you're squeezing both butt cheeks, and then we're relaxing glutes on the way down. There you go. Squeeze just a little bit, doesn't have to be too high, and relax. Little fire hydrant move, and squeeze on the way up, and relax on the way down. This one we're gonna squeeze and we're gonna hold, but bring in the abdominals, tighten your belly, pull it up towards your spine. Somebody's gonna come behind you and slap you on the butt. Hold, hold, hold. 5 seconds. Now we add in the Kegels, a little lift up, squeeze Kegel, relax halfway down. Squeeze Kegel, Relax halfway down. Think about your pelvic floor. You've got to pull it towards the crown of your head now. Scoop it up and inside your body. Lift. Good. Squeeze and lift. Squeeze and lift. Nice. Awesome, ladies. And then when you are ready, relax and release. Take a quick little break and a breath. And then we're going to try the other side. So honestly, this is just like this one. Remember when we did this one? This is almost identical. The difference is that we're weight bearing on this one. So what I usually find is some people prefer this one, or some people prefer this one. Your body's just different. So you might like this one better because you actually are bearing weight down on the earth. Up to you. Okay, we're gonna do the other leg now. Taking it up to a 45-degree angle. I'm sorry if it's bad on your knees. Grab a little towel or a pillow for cushioning if you need it. So we're just taking it up, squeezing, relaxing. Remember, both cheeks need to engage. Even though we're gonna feel it more on one side, both of them need to be squeezed. And then on this next one, we're gonna hold it at that 45-degree angle, and we're gonna incorporate the Kegels now. After a 5-second hold, do not let the glute go. Add the pelvic floor now. Squeeze more, release on the halfway down. Pelvic floor up and relax. Pulse and squeeze. Pulse and squeeze. You might even get a little bit of a pelvic curl, a pelvic tilt here. Small range of motion. Raise the leg, squeeze the glutes. Lower the leg, relax the glutes. You got it. Yep. And just a couple more. Good. Okay, ladies, and let's relax and release. Yay! Okay, any questions on Jane Fonda? Last exercise. This is true yoga in its form, and I love this exercise. Even if you're not working on your pelvic floor, it's just really good for your body and your back. Number 10, cat and cow. The peak pelvic floor engagement for the cat and the cow is in the cat pose itself with the pelvic curl tilted or pelvic curled, whatever. All right. So again, I'm sorry, we're on our hands and knees. If this is bad for your wrist, you can always come down to your elbows as well. I get that a lot. So cat to cow pose. Cat pose, rounded spine. You tuck your chin in. You're looking in between your knees, squeezing your glutes here, pulling your tummy in. Cow pose, relax. You're dropping your belly. You're actually creating an arch in your spine and you're looking up. Cat pose, tuck your tail under, squeeze. Everything is really tight, tight glutes. And then relax, go right into your cow pose, look up. Good for your back, right? Round your spine out, go find that cat pose, tight. Squeeze your glutes like somebody's gonna come from behind and slap you on the butt. And then relax through your cow. We're gonna do one more time. Hold in our cat pose. All right, now from here, your butt should be very tight. Try to bring your glutes together. Okay, hold here. I want you guys just to look at me for just a second. Watch my pelvis now. This is where the pulses are gonna come in. Tuck, tuck, tuck. So it's those thrusts again, okay? Pelvic thrust. It's kind of like the hover. So I'm staying in my cat, but all I'm doing is curling, Kegel. I'm just pushing all in the hips. Do not be afraid to move your hips. No one else is watching. I'm the only one that can see you. That's it, you guys. Good. So again, the pulse is curling the pelvis while contracting the glutes, releasing the pelvic curl as you're relaxing the glutes. Yeah, you got it. Good. I feel like this one's probably the easiest one. Cat to cow. Nice. Yep. Awesome, ladies. Good. Any questions on that one? I feel like that one is very self-explanatory. Oh my gosh. So you guys, great great job. And what I noticed, if you probably did too, is as we progressed, you started understanding what you're supposed to be feeling, understanding the recruitment, understanding why we are doing reps, holds, pulses, all of that. It started clicking. Now imagine yourself in a month from now where you're going to be. Okay, today is a fire hydrant. Today is a lot coming at you. Today was very slow. It was very involved. It was learning technique. Now you've got it. Your goal is to star, like I said, 3 or 4 of your favorites. Figure out the ones that you liked, the ones you felt the most. You were like, that one was awesome. I love that one. I felt that one. Good. Do it. If that is the one you love, then just do it. If nothing else, you get that and take that away with you. So I'm going to open it up for any questions that you guys might have. You would have to unmute yourself if you're muted.
Like every other day, do 3, or is it a daily thing?
I would say, well, it's going to depend on what you've got going on. I would say for now, if you can, try to do 5 to 10 minutes a day. When we were working with people at Dr. Crawford's, we were having them do 5 to 10 minutes every day, 5 days a week was kind of what our goal was. You'll find over time as you get stronger and your issue improves, you may not need to do it as often, 2 to 3 times a week. But at the beginning, yeah, I want to have it pretty frequent just because practice and it's building muscles, and that's what we need. Yeah. Cool. Anything else?
Yeah, Chris, that was great. Thank you so much.
Yeah,
I learned a lot, and I definitely need it. So I have a question. How you mentioned a couple other ways that you incorporate these movements, like during your daily, doing your daily do. What else can you give us some ideas? I know you said like picking up dog poop, brushing your teeth. What are some other ones that you can suggest?
Yeah. Well, like for me, a lot of times the lying down exercises are things that I will do if I'm maybe playing a game with my family or watching a movie or reading a book. I read every day. We all know this, kind of in the Arbonne world, we're always reading too. So I will, instead of just lying down on the couch, I'll sideline and I'll put the book right there and I will do my exercises while I'm reading. So it's just kind of little things like that where I'm putting a little bit more intention. Like I said, vacuuming or doing household chores, pulling weeds, just basic everyday things where now as I'm moving into a squat or lunge, I'm like, whoa, I'm going to pretend like I'm picking up a quarter with my vagina right now. So I think it's more of just a new thought pattern where you just have to really sort of realize that you can make any movement tough and you can make it work for you, not against you. Yeah, that's a great question.
Great.
So you guys just remember this. You have all of my contact information. I am going to do this probably again end of August. Not that you guys need to attend again. You guys have got the nuts and bolts. This is just going to be for new people because it's basically repeating what I just did. So use this as a referral base. If you know anybody that would benefit from it, just like Vivian came in from a referral base, thank you so much to you and to Smiley. And then if you find later on that you do want to get this little Pilates DVD kit from me, just let me know. It can be mailed to you. I think all of you guys, I mean, most of you guys are local too, so we would just drop it off, but I can mail it. It's like $5 to mail it out. And it just gives you that. It basically is a video of what we just did, and then it has this little exercise book that shows like the pictures and it describes. So if you're kind of one of those that needs that, then just let me know and I'll get it to you. So yay. All right, you guys. Well, happy Kegeling. Thank you so much for joining me today. I hope you got what you needed. And again, just private message me. I'm here. I will probably honestly be following up with you guys and finding out how you're doing. I'll give you a few days. and then in another week and another, and I'll just kind of be a little fly buzzing around, making sure that you're accountable, because I want you to put your money where your worth is here, and let's now put it into action. So, all right, you guys, have an amazing weekend.
Thank you.
Thank you.
Thanks, Chris.
You're welcome.
Awesome.
Thanks so
Thank
much.
you.
Yay.
Bye
Nice
bye.
to meet you. Bye, Mama.
Bye, honey.